After receiving the first doses this week, hundreds of healthcare workers in the Tennessee Valley now have been vaccinated for COVID-19 with no reports of adverse effects. Still, many rumors are going around that these shots are dangerous. Our Kelly Kennedy explains what the side effects are and how often they actually happen.
There are posts going around online claiming a healthcare worker in Alabama died after getting vaccinated for COVID-19. The Alabama Department of Public Health says these posts are false. No one in Alabama has died from the COVID vaccine.
We had no reports, but we double-checked all of our information, and we had no verification of this whatsoever.
Like any other vaccine, side effects can happen. The most common for the COVID vaccine are fatigue, headache, and fever, but officials say they are short-lived.
This is not unexpected with a vaccine that is given to a person where their immune system is supposed to, if you will, recognize the vaccine and build immunity to the virus. So it really shows to some extent that the immune system is working.
So far, the ADPH says no adverse reactions of the Pfizer vaccine have been reported in Alabama. However, there are some reports of people experiencing anaphylaxis after getting the vaccine. State health leaders say allergic reactions are possible with any vaccine, but are extremely rare.
Currently, the recommendations are persons who have that type of history of true anaphylaxis previously to be monitored for 30 minutes after administering the vaccine.
Health officials say to do your own research before being vaccinated. And if you think that you are at a high risk and want the vaccine, go ahead and let your primary care physician know and then be ready when they call you. For more information about the vaccine, just head to rocketcitynow.com. Putting the Valley first, Kelly Kennedy, WZDX News.